Hello and welcome to another episode of Let's Talk Health. I am your host Vijay and today's session will be on seizures. And to discuss this, we have with us Dr. Aparna Vijay Kumar, Senior Consultant Neurologist at Citizens Hospital, Nalaganda, Hyderabad. Good evening, Doctor.
Good evening.
So before we start, I would request you to give a glimpse on your expertise to our viewers.
Hello everyone. I'm Dr. Aparna Vijay Kumar. I've been working with Citizens Hospital for the past 9 years. I have nearly 18 years of experience in neurology. My expertise is in the field of epilepsy, stroke, movement disorders.
So coming to the questions, Doctor, my first question would be what are the main types of seizures and their differences in symptoms?
So, seizure is a disorder characterized by sudden jerky movements in the body. The seizure can be of two types, focal seizure and generalized seizure. In focal seizure, there is twitching or jerky movements in one part of the body like eyes, face, limbs, like arms or legs. While in generalized seizure, there is jerky movements in all four limbs. There will be deviation of the head, there can be deviation of the eyes to one side, there will be frothing from the mouth, there will be uprolling of the eyeballs, there will be urinary incontinence and tongue bite. It lasts for nearly 3 to 5 minutes and then the patient goes into a phase of post-ictal drowsiness.
My next question is, Doctor, can you explain common causes and triggers for seizures?
Yeah. So, seizures can be caused by brain stroke, brain tumors, brain infections like meningitis, encephalitis, head injuries can cause seizures. Then it can be caused by high sugars, low sugars, or high sodium, low sodium. It can also be caused by congenital malformations in the brain, like congenital defects in the brain, which can be acquired by birth. There are other genetic causes of seizures also, hereditary causes you can see. So seizures can be triggered by stress, lack of sleep, flashing or disco lights, excessive exposure to loud sounds, alcohol intake, and stress. So these are the various triggers for the seizures.
My next question is, Doctor, how can someone distinguish between a seizure and other conditions with similar symptoms?
Yeah. So seizure needs to be distinguished from syncope or fainting episode, which is commonly seen. And also it needs to be distinguished from false seizures. So as I told you, in a typical seizure, the patient has generalized tonic-clonic or generalized jerky movements in all four limbs, and which lasts for nearly 3 to 5 minutes, followed by a loss of consciousness phase. In syncope or fainting episode, the patient will have an aura phase of a very few seconds of aura, like there will be blurring of vision, there may be epigastric discomfort or butterflies in the stomach type of feeling, followed by there will be a fall, and they lose consciousness of very few seconds, less than a minute. And during this phase, there is no tongue bite or usually they will not have any tonic-clonic seizures and there will be no urinary incontinence. And as it lasts less than a minute, the patient will get up and they'll be completely conscious and there will not be any confusion or drowsiness after the episode. In pseudo-seizures or false seizures, the patient will have violent thrusting movements in the hips, trunks, head and the whole body. And it lasts for more than 3 to 5 minutes. And the patient eyes may be closed or may be open. Patient is usually conscious during the episode. Following the episode, which can last even for 30 minutes in some cases, they become conscious but they'll be drowsy. And the drowsiness is all because of their, usually a psychological thing, so they'll be drowsy because of psychological feeling. This is how we differentiate between.
Okay. So my next question is, Doctor, are there any advancements in seizure detection technology or wearable devices for better seizure detection?
So the diagnosis of epilepsy, we take the help of imaging, CT scan, MRI, and there are SPECT and PET scans also. Apart from this, electroencephalography, which is like placing electrodes on the scalp and detecting seizures. And this can go forward, like it can be an invasive procedure of minimally invasive scalp intracranial electroencephalogram, in which needles are inserted beneath the scalp to detect seizures when the scalp EEG is not detecting. This is one advancement on that. And then there are nowadays wearable sensor devices. They look like smartwatches, which can be worn on the wrist, and they detect the changes in heart rate, temperature, and the electrodermal activity, like any sweating and jerky movements. These sensor devices can, through the Bluetooth, they're connected to very phones or anything, and they can alert the caretaker as well as the patient about the seizure. They can predict the seizure also. So these are alarm systems. They can help in early detection of seizure, and also the patient can take early medical help. This type of devices, other devices are like bed monitoring systems, which can be kept on the bed in the night. The patient with seizures in the night, so they'll alert us about the seizures. And also, apart from the wearables, wrist devices, we have even pendants which can detect the body movements and alert the patient as well as the caretakers by giving alarms.
So my next question is, doctor, what treatment options are available for managing epilepsy and how effective are they?
So the treatment of epilepsy includes anti-epileptic drugs. So the armamentarium of anti-epileptic drugs is very vast, and many new drugs are coming every year. Apart from anti-epileptic drugs, the other option is, so 2/3 of the patients respond to anti-epileptic drugs. The patients who don't respond, in intractable cases, who don't respond to even four drugs, then the question comes about surgery. The surgery is for patients who have a localized lesion. So the lesion which is causing seizures is removed. Other options are vagal nerve stimulation. These are all done in refractory seizures, which are not responding to the medical management. Vagal nerve stimulation, and then ketogenic diet. That is also one of the options, along with medicines. Then there are other things coming up like transcranial magnetic stimulation, transcranial electrical stimulation, transcranial focused ultrasound for the area which is triggering seizures. So these are the various things which we can provide to a patient with epilepsy.
So the next question is, doctor, why is having a seizure action plan important for individuals with epilepsy?
So a single seizure can damage millions of neurons. So a patient needs to be seizure-free most of the time. And also a seizure, when a patient gets seizure, he can fall down, he can get head injuries, he can get fractures. So all this will impact his quality of life. So having a seizure action plan to prevent seizures and to detect seizures, early detection of seizures is very important for a patient. Otherwise, they'll have very poor quality of life.
My next question is, doctor, do lifestyle factors like sleep, stress, or diet impact seizure frequency?
Yes, definitely. As I told you before, the basic triggers for seizures include stress, lack of sleep, alcohol intake. So all these factors have an impact. So this needs to be avoided. Even nowadays with the use of gadgets, this problem of seizure aggravation has increased. Seizure exacerbation of seizures has increased nowadays. So we should avoid using cell phones for long hours, avoid playing video games, avoid being in flashing lights or disco-like places for a long time. Most importantly, avoiding alcohol, having a good sleep pattern, and avoiding stress. Very, very important for a patient with seizures. And also it holds good for general population also, because these can also trigger seizures in anybody.
So my next question is, doctor, how crucial is medication adherence in managing seizures, and are there new therapies emerging?
Yes. As I told you, the anti-epileptic drugs can make the patient seizure-free. But if the patient doesn't adhere to the medication, the patient will get repeated seizures which can impact his brain. There will be loss of millions of neurons, and they can go into memory disturbances. They can get memory loss, and they have a poor quality of life. So adherence to the medication is very important. And the new advancements in the area of seizures, apart from medication, as I told you, it's surgical management, ketogenic diet, vagal nerve stimulation, and this transcranial magnetic stimulation and transcranial focused ultrasound. These are the various latest technologies which has come up in a patient with seizure.
The next question is, doctor, what considerations should individuals with epilepsy keep in mind for activities like driving or sports?
So a patient with epilepsy should avoid driving. Like if he is seizure free for 6 months, then he can start driving after a period of 6 months. So, and about sporting activities, like mainly swimming, they should avoid swimming. All seizure patients should avoid swimming. And even if they are seizure free for a long time, they should avoid swimming. Other sports, like playing other sports, is not a problem. Driving, as I told you, after 6 months of seizure free period, they can start driving.
So my last question for the day is, ma'am, can you share insights into the emotional aspects of living with epilepsy and available support resources?
So epilepsy is associated with a lot of stigma, especially in young people of marriageable age. There's a lot of questions in the minds of people about whether we can marry a patient with epilepsy. And though now society has started accepting these people, and they've understood that epilepsy is not a communicable disease. It cannot be transmitted from one person to another. And not all epilepsies are genetic or hereditary. So it doesn't pass from generation to generation in all the cases. Epileptic patients who are on medication for a long time, they are depressed, they are dejected, they are unable to face the society because they are unable to do all the activities which other ordinary people can learn. But there are support groups, epilepsy foundation groups in India and abroad who can support these people. The people can, through these support groups, they can share experiences with others, and they can form a group where they can take care of each other, and also they can get motivated and do not feel depressed or dejected.
Thank you, doctor, for your valuable time and inputs. With this, we conclude today's session of Let's Talk Health. We'll be back with another session next week. Till then, take care, be safe.